I think the biggest contributor was stress. Is I was always the kind that would take the stress and internalize it. And I never knew how to deal with the stress. Everybody's like, oh, you need to reduce stress. And I'm like, but what does that even mean? Because it's not something that people are like, okay, you can go and do, whatever it is, but it's not extremely obvious. And I would just pack on the stress. And I think that the stress was, a bit too much to carry, and that was the breaking point.
Hi there, welcome to another episode of The Original Take, a podcast that we have here from the International Institute of Original Medicine that really looks at topical issues from the perspective of original medicine. That can be really interesting stories, really interesting knowledge, kind of bases and topics that we think people should know about in terms of alternative or natural remedies and therapies, and really putting that out in a way that's easy to consume, really easy to listen to or watch wherever you are, and just being very informative so people can know more about original medicine, about natural healing, and really kind of be more informed and more empowered to go down the natural road. So if you are new to this series of videos, do check out our YouTube channel. We've had a number of interviews on a wide range of topics. So really encourage you to check out the series. But we have another amazing conversation today with Joanna Barrett. She is a member of the IIOM family. She is a graduate of the International Institute of Original Medicine. And she's also had a really powerful story to share, or a challenging experience, I can say. We'll dive into that over the rest of the podcast. A really challenging experience, which she'll obviously tell you more about, and we'll go over that later. But she's here, and she's willing to share her story with us, and really grateful for that. So Joanna, I always say that people can introduce themselves better than I can. So perhaps the first question I have for you is just to tell us a little bit more about yourself so we know where you're coming from and your perspective.
Thanks, Seth. Well, my name is Joanna Barrett, and I live in Virginia. I am a homeschooling mom to 4 children, and also a wife. That's about me.
Thank you so much, Joanna. And it's kind of easy to kind of, when we look at anybody's story and we think, oh, that's a story for them, that wouldn't happen to me, how can I relate to this story? But I think we've had many conversations. As I mentioned, you're a part of our online community, but would you say there is anything out of the ordinary about your life? Is there kind of a secret, you're an heiress or something like that, or are you just a normal person, in terms of, hey, I'm just the person like next door that you would find next door? Do you see yourself as special in any way? And I'm asking this specifically because when we get into the conversation later, you'll know why I'm asking that. But do you feel there's anything special, anything great that that you have some special knowledge that people don't?
Well, I would say I'm pretty ordinary, quite honestly, but I've always had a drive to learn. So I would say if I had to categorize myself for a special superpower that I have, I would say it's a hunger for learning. That's my thing. But I'm pretty ordinary.
And the reason I ask is because there's a lot of people who have powerful stories to share, and it's very easy if you're listening to it to say, oh, well, that's them. But the reason I asked that question, and this is really if you're watching this video, the reason I'm asking this question is because as you listen to the rest of Joanna's story, the choices she made, the road she had to travel, Joanna is a person just like you watching this video, the same challenges in life, the same strengths, the same weaknesses in terms of we have both. But she made certain choices and she made them for certain reasons. And those choices are not exclusive to Joanna. If you're watching this video, you're able to make that choice as well. It's not an easy one, but you can. So Joanna, we'll kind of dive into the story. So perhaps you could just quickly let us know, what was your health challenge? What was your diagnosis? So, you know, as we go through your journey, people know what you were dealing with.
Sure. So back in 2019, I started with, I had pleurisy. And I had never had anything like that before, but I noticed that from that point on, I started having other health issues. I was diagnosed with Hashimoto's, the autoimmune thyroid disorder. And then I also found out that I had extremely low levels of iron. And so I was starting to feel really poorly. And that I felt was a warning sign for the following couple of years and trying to figure out my health and actually getting the diagnosis of having a tumor in my breast. And so I feel like one thing after another, it was kind of like a snowball effect with my health there.
Thank you so much for sharing that. And so that's the diagnosis, but let's rewind a little bit before the diagnosis, because that diagnosis may come as a shock. I'm sure it came as a shock to you when you actually were in the room and you had to have that conversation. But let's rewind a little bit to before, because one of the principles, the 8 laws of health, for those that are kind of au fait with original medicine, just want to look at your kind of lifestyle, nutritional choices before then, just to see if there's anything we can learn in there. So would you say before your diagnosis, what was your lifestyle like? Do you think you were doing well, so to speak, kind of being healthy before your diagnosis?
I thought that I was. You know, when my children were born, and going back even further, we've got such a history of breast cancer in my family that I tried to implement changes from the time that my children were small because I didn't want them to have to deal with anything. So in my mind, I was thinking, I've made changes. We didn't eat processed foods. We stayed away from sugars. We were eating what I thought was pretty healthy. And so looking back now, my views have changed about our diet, but I felt like we were doing pretty well.
And so, for those that are kind of more have more knowledge of original medicine or natural practices, and there's that checklist. Okay, it's a plant-based diet. It's okay, reducing processed foods. They're things you'll hear a lot of in terms of having a healthy lifestyle and diet. But you felt you were doing those things. So that's an interesting dynamic. So the question that comes up is, were there any other factors that you think in terms of life events that you think contributed to that, despite you, from your perspective, having a very healthy kind of nutritional, making very healthy nutritional choices?
I think the biggest contributor was stress. Is I was always the kind that would take the stress and internalize it. And I never knew how to deal with the stress. Everybody's like, oh, you need to reduce stress. And I'm like, but what does that even mean? Because it's not something that people are like, okay, you can go and do, whatever it is, but it's not extremely obvious. And I would just pack on the stress. And I think that the stress was, a bit too much to carry. And that was the breaking point.
And was there kind of a specific life event that triggered that? Was it just kind of accumulation of stress, or is there an event that you can look back on now and say, actually, that was really quite an acute stress moment that maybe tipped me over the edge, or it was something that overwhelmed me? Was there anything like that, in your life that happened?
Yes. Yes. I do believe that the stress was a culmination of a lot of years of just not handling it. But my father did pass away unexpectedly, and that was in 2019. And that's right before I was hit with all those other health issues. And it's funny because I also I read a ton of books, and I have a book here, Metabolic Approach to Cancer. Um, I read so many books, but in this book, if you don't mind, that I can just quote from it. It says the German physician Reiki Gerard, and I don't know if I'm pronouncing the name wrong. I'm sorry. But Dr. Hammer has asserted that cancer involves a specific area of the brain that controls a conflict related organ or tissue. His controversial yet well studied theory is that cancer originates from an unexpected shock experience, such as the loss of a loved one or a divorce. And so that really stood out to me because I was like, I do believe that my father, his passing really did play a part in it. So
and again, for those that are kind of new to original medicine, original medicine really looks at underlying causes and contributing factors. It doesn't just look at the symptoms. And so if you kind of take that principle and apply it in this case, it's really understanding that the body is not just physical, there is a psychological element, and how we think and how we feel has a definite impact on our bodies, on our chemical processes. There's a huge amount of research done on that. But if you're kind of wondering what the book was and you're trying to pausing to rewind, don't worry, we'll make sure all the links are in the video description. So don't worry about that. Just really, you can put your pen and paper away and just really listen into a great conversation. Thank you so much for sharing that, Joanna. And I think it's really important that you bring that out, which is that people can look at purely the lifestyle, purely the nutrition, and they actually miss out on a really important facet of human health, which is the mental, the psychological, the spiritual if you're that way minded as well. But it all feeds into how we are as a human being, and we are a interrelated being. We're not purely physical, we're not purely mental, we're not purely emotional. We are a human being that encompasses all of those elements. So if you're doing great on the physical, and there's some really big stressors on the mental or the emotional or the spiritual, that's going to impact on your body. It's going to manifest very physically. They all interrelate. Am I going off on a ledge saying that, Joanna, or is that something that relates with your experience as you reflect on it now?
it absolutely does. I honestly never realized how much stress plays a part. And I was like, you know what? You drink your water and you exercise and you eat a balanced diet, and your spiritual life, it does have to do a big part of your health. And there have been so many studies on that too. But I was like, I know stress is supposedly the silent killer and all this stuff, but I don't know exactly what that means or anything like that. And now I understand it is a very delicate balance, but it has to be, everything contributes to that balance. And it's really important.
Yeah. So there will be many takeaways to take away from this conversation. And I think that would be, as I listen to it, that would be one I would take away, is to really look at health holistically. Because as you said, Joanna, there are many silent killers, stress being one. There are many others if you look at it from the perspective of original medicine that conventional medicine perhaps doesn't play so much focus on. But we are interconnected beings, and how we feel, how we think does affect and manifest. Challenges can manifest physically. So one final question, just kind of doing the big rewind we're doing pre-diagnosis. As you look back, Joanna, is there anything in your life that you can see like were warning signs? You mentioned you had other health challenges starting in 2019 with the sudden passing of your father. Do you think now, as you look back, that those were warning signs, your body trying to tell you, hey, something's going on? Do you feel that now, or do you think it was just, hey, it came up out of the blue?
I definitely think that those are warning signs that my body was like, you know what, we need to take care of our body. And it's hard because when you're going through the thick of things, you're so focused on taking care of this one issue in front of you that you're not really looking down the road at like a more full picture. But all these little things, they were warning signs for me, and it really um, it contributed to the big picture that I missed out on at the time. But now it's so clear to see that, looking back. But those were
Uh,
definitely,
there's
yeah.
always the phrase, hindsight is a wonderful thing. Everybody has perfect vision in hindsight. But as you say, it's, again, maybe another little point as you're watching this video or listening to this conversation, just to maybe make a mental note of, or a physical note if you've kind of ignored the advice to put away the pen and paper and just listen. Maybe this is your second listen or view through. That our bodies really do try and communicate with us. And if we're paying attention to those things, our bodies do give those warning signs that all is not well. It may be something like, hey, you're not quite sleeping right, or you're having problems with focus and energy at work, or there's so many ways our bodies try to talk to us and let us know, hey, everything isn't okay. But because of our lifestyles, because of the way society is, it's kind of ignored, and we just soldier on because we have to. But I think kind of a second big point to just make a note of and be conscious about as you're listening and watching this story is to really take the time to listen to your body. Because if you do stop and you do listen, you'll hear your body, and hey, this isn't quite right. Okay. And then the next question that we'll go on to later is, okay, but what do I do about this? We're not powerless. I can say that for sure. There are things that we can do, you can do, to really take charge of your health and listen to your body and do the right things so your body can adjust in a healthy way. So that's the pre-diagnosis, that's the context. We always try and dive into the meat of the story, if I can say that, or the lettuce of the story in context. But we really try and provide that context whenever we're having stories, so you can judge for yourself where somebody's coming from, and that story you can make it your own. So that's Joanna's pre-diagnosis. But let's turn, Joanna, to the diagnosis itself. What was it like to hear the news that you had cancer? And I know, perhaps maybe I can just stop here and check. I know that I've not had cancer before. What term do you use to describe it? Because I know that it can, obviously it's a very challenging situation and it can have a lot of associations. Is that the wording you use, or what's the best way to describe it?
I typically say that I had a breast tumor. The word cancer, and maybe not for me so much personally, but for people that I have encountered, that word terrifies people. And also, there's such a negative, like almost like a death sentence associated with that word. And people just, they kind of freeze up and they're like, oh my goodness, like I don't know what to do or how to support or anything like that. Like, I'm really sorry. And it was very negative, where when I'm like, I have a breast tumor, and people are more almost hopeful, like, okay, that's not terrible, it's not as bad as cancer or anything. And I'm like, they're one and the same. But it's the terminology that it's such a huge difference. And I didn't want that negativity around me, because I had enough going on that I wanted to separate from that negative, like any negative feelings. So I do prefer breast tumor. All that for that answer.
No problem. Okay, I will try and do
Oh,
that
I
moving
can't
forward
hear
in
you,
our
Seth.
conversation.
Oh, there you are.
And
Sorry.
I will try and use that terminology in the conversation. And as I come across people, I think it's often we assume and we sometimes don't realize how a careless word or can really impact people. So to be conscious about that, I will try and be mindful of that as I engage with people that also have tumors in different parts of the body and be sensitive to that. So I appreciate you sharing that, Joanna. So what was it like to hear the news you have a breast tumor? What was it like? And I know it's kind of revisiting some challenging and painful experiences, but as much as you're able, what was it like to sit in the room and hear that news, that diagnosis? Because there may be people that are watching this video that potentially have a diagnosis pending, have had that diagnosis recently, they have loved ones that have had that diagnosis. What was it like for you? What's your perspective? What's your story as you were told you have a breast tumor?
Well, like I had mentioned before, my family had a history of this. And so I had implemented these changes that I thought were really good. So when I heard that, it was like a punch in the gut because I was thinking, I've done all these things to avoid hearing this. And I was completely caught off guard. It was just something that I had never expected that I would be experiencing. So it was very shocking.
And in terms of, how can I say this? You mentioned that family history. Did that kind of multiply the shock and the negative impact? Because obviously it's something that you're aware of. Maybe you're not consciously thinking about it every day, but it's in your conscious back of the conscious, maybe subconscious mind that you have this in your family. Did that kind of play a role in your feelings at that moment?
Oh, that's a good question, Seth. I will tell you, when I heard that, I just had flashbacks of like my mom going through the chemo and being so sick, and my grandmother when she was in the hospital beds, and all it was like a video that was playing in my mind of all these things just at that one moment. And it was a bit terrifying because of all of the history that we have had in our family. And it was it was incredible how it was like a fast forward picture that just flashed through.
And I think it's hard from my perspective to really put myself in your shoes. But again, we do this series and we have this podcast and we find stories like Joanna's. So there may be people that are going through that or might be about to go through that. And we try and surface these stories. And I really appreciate you sharing, Joanna, what it's like and to try and provide a bit of hope, a bit of something to give people the strength to kind of move through these conversations and not totally fall apart. Because I can say Joanna is here. There were challenges in her journey for sure, but she is here. So that is hope for people that are at the start of this journey, that the journey can have a positive ending. So Joanna, in terms of, you've had the diagnosis, there's all that baggage and all of that history that you've mentioned with the family. How did you decide to respond in terms of treatment plan? Obviously, there is the kind of traditional mainstream approach that obviously includes chemotherapy, radiotherapy, all the different conventional, I should say, approaches. How did you decide to respond to your diagnosis?
Well, for me, it took I took into account watching my mom go through the chemo and watching my grandmother go through the radiation and chemo. And like I said earlier, that I love reading. So I like to research things. And way back, I had read a couple of things about alternative ways to help with cancer. And I was like, you know what? This really resonates with me. But it was something that I never thought that I would ever have to deal with. So that was in the back of my mind. And when I was thinking about how I was going to approach and everything, I I I have faith in God, and I was prayerfully considering everything and just kind of saying, God, you need to lead me. And I I really felt a certain way when I would think about going the traditional route. I kind of started getting almost anxious feelings. My heart would start racing, I would start sweating, and I was like, this is not really normal reaction. Where when I was going the route of alternative therapies and not even doing them yet, just considering them, I felt more at peace. And I felt like this is something that I am comfortable with, that I feel for me would be the best route to go. It's not making me anxious, it's not making me nervous, it's not, any of these negative feelings. And I had wanted to stay away from the negativity. And I was like, you know what? This is also negative, having these anxiety feelings. So that's what I went with.
I appreciate you sharing that. So you kind of, if I can sum up in a clear way, you decided not to go down the conventional route of chemo, of radiotherapy. You kind of decided to go off into the woods somewhere, and in the road less traveled, if I can use that expression. But that's the kind of the what. You decided not to go the conventional route. The question that I'm certainly interested to hear, and maybe people watching this video podcast as well, why did you decide to go that way? Because there's so many people that go the conventional route. That's the very well trodden path. That's where a majority of people, that's the treatment route they decide to go down when they have that diagnosis that you had. Why did you decide not to go that way, and the way you did?
There are many reasons, quite honestly, but a lot of it was the research that I had found. Um, when I really dug in, I was looking, and I mean, the chemotherapy, it doesn't reduce the risks of it doesn't reduce the risks by a significant amount. And so I'm thinking, why would I put chemicals in my body to make me weak, which also would affect my family? Because my youngest is 5 years old and my oldest is 12. And because we homeschool, I need to be present for them too. And I need to be able to be strong. And seeing as how my mom, when she was going through the chemo, she wasn't able to get out of bed. She was so sick that she wasn't able to do much at all. And I was thinking back to that, and I'm saying the risks just don't outweigh the benefits. I said that backwards. The risks outweigh the benefits. Anyway, sorry about that. But for me, the risks were too high to consider the small benefits um, that may come with going the conventional route. And then the research that I had, it backed that up, that it just wasn't a choice, that wasn't something that I wanted to pursue. If I answered that.
Yeah, and in terms of, you had that diagnosis, did you kind of go for kind of other opinions, or did you just have that one conversation and you said, okay, I don't want to do this, I'm going off and making the choice I want to make that I'm comfortable with? Or did you kind of do some search? And you mentioned you're a person that you like to research. Did you kind of go to different people? How did you approach that after that first conversation?
Yes, I met with a functional oncologist, and she explained to me the natural route and how we would tackle this. And then I decided to also have opinions with conventional oncologists. So I actually saw two conventional oncologists and breast surgeons, and I heard what they had to say, and I thought about it logically, and quite honestly, I got such a negative impression because of them. And if you also don't mind, I will show you. I don't know if you can see, there are a lot of papers here that are published scientific studies that have been published in medical journals that the oncologists, the conventional oncologists that I met with, they dismissed those. And when I had asked about them, they said I needed to stop reading things on Facebook. And I was like, that's very dismissive. I'm not reading things on Facebook. I'm reading things in published scientific journals, and they're dismissing the science. So, how can I trust what they're going to recommend for me if I can't trust that they're even trusting the science? So, I did I did go with both aspects, and I weighed what both of them had said.
Yeah. And I think this is the next point to kind of virtually highlight, hopefully mentally make a note and watch the conversation again. What I take from what you said, Joanna, it's a principle that I think is really important in life. And it's come through in the conversations we've had in this series before, especially with Rudy Nassif, is that we really have to learn to respond in life and not react. I cannot imagine what it must have been like to be in that room to hear that diagnosis. But what I can really celebrate in what you've said is that despite that shocking punch in the gut kind of news, that you really endeavored to respond, to say, let me weigh, let me not rush because it's an unprecedented situation. Let me not react and say, okay, okay, you take a breath, you take a pause, and you reflect and you think, how do I want to respond to this sudden, shocking, somewhat fearful news, but how do I want to respond? Let me weigh, let me reason. And I think if you're watching this, that's definitely something to make a note of. And it's not just in the context of health. That principle is something that you see in the entirety of life. How can we learn to respond, to rationalize, to take a breath before we decide, as opposed to reacting, which has much less rational thought process. And it's just oh, I'm going to do this, without really thinking of the consequences and the implications of that choice. So Joanna, really, it's just really so much deep insights and knowledge that you're sharing with us, and I just want to appreciate it, because it's something that runs through life, even though that we're talking in the context of health here. Though some of the principles that you're bringing out apply to other areas of life as well. So thank you so much for that.
Jump in also and add to what you just said. I think understanding that a tumor, before it can be detected, has already been, from what I have read, it's already been forming for 7 years before it's even able to be detected. So with that knowledge, I knew that I did not have to act immediately, and that there was time to be able to research. I will say that the conventional oncologists, they did try the fear tactic with me, and they said, we need to take care of this tomorrow. We need to take care of this as soon as possible. And I'm thinking, from the knowledge that I have, as well as thinking, I found out about this tumor in the end of June, and they didn't even schedule me or see me until October. If this was a real rush, they would have gotten me in sooner. So when I asked about that, the doctor got very angry and was not happy with me at all. But I'm thinking I need to approach this in a logical manner. And with knowing that about how long a tumor takes to develop, that there's no rush. You don't have to make a decision immediately. So I just wanted to add that in there.
Thank you so much for that, Joanna. So just turning to, we've talked about the decision you made and a bit more into why you made it. How did people around you react to your decision? Many people in life will know that if you choose the road less traveled, that can often lead to a lot of questions from people around you, doubt perhaps, discouragement. How did people around you react, Joanna, to your choice to say, I'm not going to go the conventional way that a majority go down. I'm going to go and choose the route that in my heart I feel is right for me based on not just my emotion and feeling, but the rational research I've done. How do people respond to that decision you made?
Oh, that was not an easy thing for me. There were so many people that were very, well intentioned, but they did not like the decision that I had made. And they made that very clear. And that made it very hard for me because I did not feel like I had the support that I really needed to be able to go down this path that not very many people go down. And so I had a lot of pushback from a lot of different people, um, a lot of different close people that I felt like I needed the support about which direction I chose. But, I kept saying to people, like, I'm not choosing to die. This is not what I'm doing. So I need you to understand that I'm going this path because I feel like this is what's going to bring life and bring a good outcome and not bring negativity and end in a bad situation. So it was hard because there were not very many supportive people.
And how did that, how can I phrase this question? What was it like for you experiencing that lack of support? Because the reason I'm asking is there may be people who have, you're at a similar stage where they've had a diagnosis, or they might have an appointment in the next few days, where they will have the diagnosis that you had of a breast tumor or a tumor of any kind in different parts of the body. What was it like for you to experience that lack of support? And I'm asking this question because there's going to be a question I'll ask later. But I just wondered if you could share what it was like to not have that support. So if there are people watching this video that have loved ones that are going through this, that they can really understand what it's like and what support could look like in a way that the person who's had the diagnosis would appreciate. So there's a few questions in there, Joanna. I apologize for that. The first part of the question, I'll just say it again one more time. What was it like to experience that lack of support?
I felt like that was very alienating. I felt like I kind of had to kind of rely on my own things that I found. And quite honestly, that's probably why I read so many books on cancer, because I wanted to find the support that I needed through other people's stories. And so they call it radical remission, when a tumor just disappears. And I found by reading a lot of those stories that I got the support that I needed. And I will say, I think this is the second part of the question that you had asked, that somebody can be supportive even if they don't agree with the route that somebody's choosing to take. And the support doesn't need to look like, yeah, let's do this treatment or anything like that. It can be like, not quite sure about this treatment, but if that's what you think is best, then I'm here for you. I'm here to listen to you. And, if you need me, just rely on me. Call me or discuss this with me. Tell me if you're, how you're feeling or how you're doing. And the support is a huge aspect.
I think this is another virtual highlight moment. Just picking up on what you said there, Joanna. I think when we people close to us are experiencing challenges, and it's very easy for us to slip into the mode of, I see a solution. This is what needs to be done, forgetting that actually we're not in the situation, we're not experiencing it directly, and the emotions and the thoughts and the feelings that are experienced when you're the person going through it. Sometimes in those moments, to help that person the most, it's a simple, how can I help? What do you need? It's not about you as the person that's looking on and trying to support. It's about the person that wants to be and needs to be supported, and in a way that they need to be supported. That's the important thing. So if you have friends, family that are going through these challenges, and there maybe you disagree with the way they're going, just remember they're the ones that are experiencing it, and the simple question of how can I help? What do you need? Can really have such a positive impact on their experience, because oftentimes the feeling of loneliness, as Joanna mentioned, of isolation, is really almost worse than the diagnosis itself. Because as we said earlier, it's not just physical, it's emotional, it's mental, it's spiritual, all of it comes in together. So just keep that in mind if you're somebody who's very close to somebody who's had a diagnosis like this, and be mindful of how you can best support the person. So thank you again, Joanna, for bringing that up. The next question I have for you is, how did you find the strength to go the road less traveled, considering it's a road that the majority don't go down? You've just said in the last kind of group of questions that you didn't have unanimous support from people around you and people close to you. So how did you find the strength to go the road less traveled?
Well, I prayed a lot. I was very much in the Word and just trying to hear God leading me, and that's what I found the strength in. And then the stories of other people, and trying to surround myself by positivity through finding really their strength and piggybacking off of that, really.
And I know, because we, as I said, you're part of our community, and I've had the privilege of hearing Joanna share this story before. Joanna, there's a story about the UPS man. I'm going to stop there and say no more. Could you tell us the UPS story?
Oh, yes, I can. So, the UPS guy, I was praying one day and I felt like God was telling me to ask him to pray for me. And I was like, okay, this is very strange. I've never like stopped the UPS guy. And I mean, we were friendly by saying hi and thank you for the packages and everything. But I was like, all right, if you're telling me to have him pray for me, then I'm going to go ahead and ask him. And one day he came and I asked him to pray for me, and he put the box down and he turned around because he was walking back to the truck. He turned around and he said, what's going on? And so I told him, and I'm just assuming that he's going to say, okay, I'll pray for you, but he turned around and he came right over to me and he put his hand on my shoulder and he prayed a very powerful prayer. And it was everything that I had been praying for. And I think I was in tears at this point. But he finished praying for me and he turned to walk back to the truck, and he stopped and he turned around and he said, why did you ask me to pray for you? And I said, I just felt like God was telling me that I needed to ask you. And he said, well, did you know that I'm the pastor of the church down the street? And I said, I had no clue. I'd not known that at all. And it was just incredible. But the whole congregation from that point had started to pray for me too. It was powerful.
And I think it's, there may be people that are watching and viewing this that they aren't spiritually minded. God is not someone or something that they believe in. But what I would say is that when you are in those situations, I've not had this situation, Joanna, I've not had a diagnosis of a tumor, but I've been in my own mini versions of challenging situations in life. And I think it's one where when you're in those situations at that moment, a lot of things go through your mind. You realize your position in this big thing called life. And I think if you're a person of faith, that's certainly something I fall back on, because when faced with that reality, it can be crushing. It can be too much if there's nothing for you to hold on to. So even if you're a person that is not faith-minded of any belief, I would just challenge you to reflect on that in those challenging situations you've had in your life, and those feelings of, oh, okay, it's overwhelming. Like, this is a situation bigger than me. What then? How do I respond? And I think that's something where, Joanna, as you said, your faith was a really important support for you to find that strength to move forward and continue on the road you traveled, less traveled. So that's kind of in terms of the diagnosis. We've kind of gone through pre-diagnosis, we've looked at diagnosis. So let's turn, if I can, Joanna, to the healing part. And you went down the road, and looking a little bit more about what your road looked like in terms of going the alternative and the natural route. What was your healing plan? What were your protocols? You didn't do chemo, you didn't do radiotherapy. What did you do?
I did a lot of different things. I tried to change my diet. I did change my diet drastically, quite honestly, which was very challenging. And I put a bigger emphasis on the stress management and trying to detox and supplement with every different thing to try to strengthen my body. But there were many things that I did.
Could you maybe perhaps share a few of those? And I know it's hard to go into the ultimate detail on absolutely everything. Perhaps we'll figure out a way to kind of get that information before maybe we have another conversation, Joanna, where we go exclusively on the kind of treatment protocols and the path that you went down. But could you just give us an overview of the kind of things that you incorporated into your own plan?
Well, I did a lot of various things. Like I said before, that I changed my diet, and that was a pretty drastic change. And it was also very challenging because my family wasn't on that same diet plan, which was, making so many different meals was very challenging. But I also incorporated things like using the sauna, and I would get vitamin C and also mistletoe IVs. I did the Zyto scan, and I also took a bunch of supplements. I took so many supplements, I feel like I wasn't hungry after I took the supplements. But there were a lot of things. I tried to flood my system with the juicing and smoothies. I needed to get more nutrition, and so that was my main focus. But I had read that laughter therapy helps so much, so I tried to incorporate that into everything as well. So there was a lot.
Yeah, I thank you for that, and we will try our best. Perhaps it will be another podcast where we really will dive deeper into those protocols. We'll work on that. But Joanna, thank you so much for sharing that. And if you are interested in understanding more about those protocols, We'll put some information towards the end of the video and in the video description, so you can kind of engage more and dig into that more. So we'll make sure that information, or the starting point of that discovery journey, is available. I know Joanna has done a lot of research in this area, so perhaps we can work something, a summary of that information if you're interested in that, watching this video. So do keep an eye on the video description. We'll make sure that the information is there in some shape or form. So Joanna, just a quick question. I know you are a member of the community, as I said. I've had the privilege of knowing you and hearing your story before. I know that you were studying original medicine, as you were kind of going up to and going through this kind of health challenge and this diagnosis of a breast tumor. How did that learning, you mentioned that you're a person that you like to learn, you like to research, you love to grow through learning. How did your studies, while you were going through this diagnosis and you were dealing with the diagnosis of a brain tumor, how did that impact on your decision and your experience and your journey to go the road less traveled and go the alternative way to treat your breast tumor?
With that, I feel like the education that I had received was a very good foundation for the choices that I made. Going through the classes that I had already taken and everything, some of the things that I had read, would pop back in my mind, and I was like, you know what? I need to go find that information again. So it helped me with figuring out the course that I wanted to go, because I knew that I had read something about this and I needed to go and search for it again. And it taught me how to research things. So I felt it was a very good foundation.
So let me ask you this question. You mentioned that you did a lot of different things, and the challenges. So one of them certainly of not being on the same meal plan, certainly as the rest of your family. What were some of the other challenges you had on going the alternative and the natural way, as opposed to the kind of conventional way?
Well, some of the other challenges were just, there was, like I had said before, we were homeschooling, and it was challenging because I was trying to do the IV therapy. I had to stagger it because they wanted me to go every week, but you can't find natural health around where I am. So I had to drive an hour and a half or 2 hours for this therapy. So between the IVs and the lymphatic therapy, I was staggering them. Every other week I would go, and I would have to take my kids with me. And so I would be there with like the IV, and I'm trying to teach my kids while we're in this little room. But it was challenging just to not be able to have natural health around me, and having to drive so far, and it just threw off our whole schedule. And my kids were affected with their attitudes because it was a lot on them too.
Can't have been easy, and I think it just goes and says a lot, the strength you had to continue and persevering. It's hard enough just you having to go through this and finding the strength, but when you have children and they're impacted by your choice as well, there's a lot to really carry. So I really just respect you so much, Joanna, for making the choice you did, knowing that the consequences of that choice, and the lack of support that you experienced as you made that choice, and yet you persevered and kept walking that path anyway. I think that's I have to really respect and appreciate you and affirm you for taking that step. So just thank you for sharing and being vulnerable enough to share that with us, because I know there are so many people that will watch this video and take consolation, they'll take hope from that they're not alone. And then, as I said, I've said it many times in this before, you're here. So the story has a positive ending. It wasn't, as you said before, it wasn't a death sentence. You are here. So thanks for kind of sharing a bit more about your kind of response and your kind of healing journey. I guess it's somewhat apparent by the fact that we are talking, but what was the kind of end of that healing journey that you went the road less traveled? How did that end up? I'm assuming you went back for the different tests. What was the final conversation you had to say, well, what did they say? I won't steal it from you. How did that happen?
Yes, I went for the MRI just in February, and they told me that the tumor was completely gone. They could not find it on the imaging at all. So that was a really positive outcome for what I felt like was really hard work. So it was very rewarding.
And how did those around you? Because you mentioned there were people that said, "Hey, Joanna, I don't think you should go. I think you're doing the wrong thing." Again, it's not you. I know you as a person. You're not a person to say, "Haha, you see." But what was it like for you once you had that very opposite? You've gone full circle from, "Hey, this is your diagnosis. You have a breast tumor," to having the MRI to saying, "We can find no breast tumor." What was it like? How did people around you respond to that? And how did you respond to that yourself in terms of that news, that relief, I would assume, of, hey, the breast tumor isn't there anymore?
Well, I will say that the people that gave me the most pushback did not have much to say about the final outcome, which I found pretty surprising. But at the same time, I was kind of expecting that as well, because it's hard when you are so set on this one path and you think that the outcome is going to be a certain way and it's not that way. Um, for people to acknowledge that, I think would be pretty difficult. Um, so I didn't get much of a reaction at all. But for me, it was very, I would say, almost a rewarding feeling that I had, because I was like, God led me through this whole thing, and I was following everything that I was being led to and relying on faith so much. And the outcome was, I mean, it was life giving. So I felt like it was such a good, relieving feeling that came with it.
Yeah. And just turning then, so that's really the story. The potted story of Joanna's journey from a diagnosis of a breast tumor to an MRI scan, where what the answer she received from the medical professionals was, "We cannot find any tumor." That's the journey. But Joanna, I know you are a person, that you are a learner, you are a reflector. What have been maybe one or two of your big reflections as you look back? You put on the perfect 2020 lenses of hindsight. What are your maybe one or two? I know you have probably 1,000, but what are one or two of the main reflections that you take away from your journey from diagnosis to we can find nothing?
I think having a positive outlook is one of the biggest things. Um, I feel like in order for somebody to be able to, come to a problem and figure out a solution, that the mindset is a huge factor in the outcome. And I would say stress management is the other thing that is really important, because without those two things, um, everything else, being able to be led by what you feel like you need to do and having the strength to actually do it, and all the other things, they they really are affected by those two aspects.
No, and I think that's so powerful. It's really there's a lot of wisdom in what you're saying, and it's wisdom that is validated by experience. So if you're watching this video and you're going through any kind of, you've come across this video randomly, you don't know why you got here, but you're kind of watching this video and you've kind of stuck with us to this point in the conversation. What Joanna is saying in the context of her health journey and the challenges she had to overcome, those lessons and those learnings and those reflections are equally applicable in other areas of life. It may be that you're in an earlier stage of life, you have exams, you're at university and there's a lot of stress coming that way. It may be that you're kind of growing your professional career and there's a lot of work stress that's on you, or you may be starting a family and there's a lot of stress there. What Joanna is sharing is something that cuts across all of those life experiences, and it's just something to think about and reflect on. And that's really where I would say original medicine differs from the conventional approach in looking very holistically about health, not just focusing purely on removal or remediation of symptoms. And that's a very different philosophical approach to health and healing that I think, Joanna, that's been your experience and it's validated by your experience. So something for people watching this video just to reflect on themselves and how that principle can come out in other areas of life. But Joanna, I just want to ask you probably one of the tougher questions, if I may. You are a person that took the road less traveled, and there may be many, many, many people that somehow have found this video and they've reached this point in the video and they're saying to themselves, well, that's all well and good, Joanna. That's your experience. That's your journey. I'm here. I'm having to deal with my experience, my journey, my diagnosis. And they have a choice to make, the same choice you had to make. What would you say to people that are standing at that fork in the road between going the conventional route, going, chemotherapy, radiotherapy, following the kind of majority recommendation that a lot of oncologists will give you, but there's another road, a road that you chose to travel? What would you say to people that are facing that fork in the road and that choice?
For that, I would say that there is always the conventional route. And for me, my decision was based on the fact that I wanted to go the more natural route and I had time to change paths. And I was monitoring the cancer marker levels. I was going for imaging. So there were things that I was doing to monitor where I was at. And I was saying, if I saw the levels increasing or the imaging was showing that the tumor was growing, I needed to reevaluate. And there were different, I would say, naturopathic, holistic health things that I could do. But I also could go the conventional route too. So there was always that conventional route to fall back on if I felt like it got to that point. So, my advice for somebody else is to say, you need to evaluate where you are in your path and your journey and see, there have been so many radical remission stories of people that were in the stage 4 cancer that radically changed and they were able to completely be healed. I'm not saying that that happens for everybody, but at the same time, I feel like you can always try something for a little while and see, is this working? Do I need to reevaluate or do I need to go a completely different path? So I would say to evaluate everything and make the best decision based on your unique situation.
That's powerful, Joanna. Thank you so much for sharing that. There's so much power in what you said. And I hope that if you're watching this video and you're in a similar situation, or any challenging situation in life, but I think in this context, if you've sat and you've had that conversation that Joanna mentioned earlier, I hope this conversation has given you a ray of hope, a spark of something that you can get up and you can find the strength to endure, and that your ending is not necessarily 100% negative. You have options, and there are other people. You are not alone in experiencing this. There are other people, as Joanna has shared today, who has sat where you have sat and has had to make a choice that you have made or you're about to make, or whatever that may be. And as I've said many times in this podcast, Joanna is sat here sharing her story. And that's powerful in and of itself. So Joanna, thank you so much for sharing that. I have one last question for you though. Obviously you're here sharing with us and sharing with the people watching this video, which is amazing. And I'm so appreciative of you doing that. But what are you doing now? Obviously you've got this powerful experience, challenging, painful, but I'm a firm believer that there is a lot of power in pain if you're able to accept it and learn from it and grow from it. It can be an immense growth trigger in terms of your mentality, your approach, how you respond to life. So what are you doing with yourself now? I know you mentioned you were studying earlier. You're here sharing with people. So you've obviously taken a step that you don't want to just keep this experience to yourself. What are you doing now?
Well, yes, I was studying earlier. I was able to graduate. Quite honestly, this whole path that I was handed, I guess, I used my school to distract from what was going on. So I was studying and learning, and now I have a health practice that I am trying to help other people with their health issues that they are facing. And it's rewarding to be able to help others.
You know, we were talking just before we hit the record button, and we were just, you know, as we do, have a conversation about life and how things were and how things are going. And one of the parts of the conversation, it's a shame that the record button hadn't been pressed yet, but we were talking about what it means to give. And the more that you give with a cheerful heart, and the more you give to others genuinely, not expecting a return, or not because you're doing it for yourself to make yourself feel good or for your egotistical reasons, but because you genuinely want to help people, that has such a powerful positive influence on you just by giving. So Joanna, thank you so much for giving, in terms of sharing your story with us here. Thank you so much for giving in terms of sharing your experience very practically with people, using your studies and your knowledge and your experience, helping people practically with their health challenges. Just want to thank you so much for being willing to give, despite the painful experience that you went through. And thank you so much for sharing with us today. I know that there were many people that will have appreciated you sharing your story. And I have nothing more to say other than appreciation, Joanna. Thank you so much for being with us today. Thank you so much for sharing. And I really just pray everything that you have an amazing continued journey in life.
Thank you. I really appreciate you speaking with me about this and letting me share my story and, you know, all the support. I really do appreciate it, Seth. Thanks.
Most welcome, Joanna. And thank you. The final thank you to the people that are watching this video. If you've made it this far, we really appreciate you sticking with us. I hope you found it valuable. If you do appreciate it, please just hit the like button. You know how the algorithms work. There may be somebody that really needs to see this video, that needs to hear Joanna's story. So if you appreciated it, please just share a like, hit the like button. We do have a lot of other content on original medicine on the channel, so do subscribe if you are interested. There's a whole host of other videos we have, and I hope that you're enjoying the Original Take podcast series. check out the other videos, check out the other podcasts. They're on the YouTube channel as well. And we'll be having many more conversations like this, looking at health from the perspective of original medicine. So Joanna, thank you again. Thank you to everybody that's watched this far, and hope to see you again for the next episode of The Original Take. See you soon. Bye-bye.